How does a bladder biopsy differentiate bladder conditions? Imagine trying to solve a mystery where symptoms like blood in the urine, frequent urination, or pain could point to many different causes. A bladder biopsy is a key tool that helps doctors uncover the true answer by examining tissue from the bladder lining under a microscope. This process is especially important when initial tests or symptoms suggest something abnormal but don't give a clear diagnosis. The bladder is a hollow organ that stores urine, and its inner lining, called the urothelium, can be affected by various issues. These include infections, inflammation, benign growths, or cancer. Because many of these conditions can cause similar symptoms, doctors need precise ways to tell them apart. That's where a bladder biopsy comes in. Usually, a doctor performs a procedure called cystoscopy first, which involves inserting a thin tube with a camera into the bladder to look inside. If they see any suspicious areas, they can take small tissue samples during this procedure. During a bladder biopsy, the doctor uses special tools to carefully remove tiny pieces of tissue from the abnormal area. These samples are then sent to a pathology lab, where a specialist examines them closely. The pathologist looks for specific cell changes that indicate different conditions. For example, if the tissue shows abnormal, cancerous cells, it confirms a diagnosis of bladder cancer. If the cells look normal but there is inflammation, it suggests a condition like cystitis, which is inflammation of the bladder. The biopsy can also identify rare benign tumors or precancerous changes, helping guide treatment decisions. When it comes to bladder cancer, the biopsy can identify the most common type, called urothelial carcinoma, which starts in the lining cells. It can also help distinguish other rare types like adenocarcinoma, which arises from glandular cells. The biopsy results can determine how aggressive the cancer might be by grading the abnormal cells. While the biopsy provides critical information about the presence and type of cancer, more detailed staging usually requires additional procedures, such as imaging or surgical removal of the tumor. In cases of inflammation or other non-cancerous conditions, the biopsy helps rule out cancer and confirms the diagnosis of cystitis or other benign issues. It can also detect early changes in the tissue that might suggest a higher risk of developing cancer later. Because symptoms and initial tests can sometimes be inconclusive, a biopsy offers a definitive answer, making it a vital part of the diagnostic process. It's important to remember that a bladder biopsy is generally safe, but like any medical procedure, it has some risks. These include minor bleeding, infection, or discomfort during or after the procedure. The accuracy of a biopsy in diagnosing bladder cancer is very high, but no test is perfect. Sometimes small or flat tumors can be missed, especially if they are not visible during cystoscopy. That's why doctors often combine biopsy results with urine tests and imaging studies to get the most complete picture. Ultimately, the goal of a bladder biopsy is to provide clear, accurate information that helps determine the best course of action. Whether it confirms cancer, rules it out, or identifies another condition, this procedure plays a crucial role in guiding treatment and ensuring the best possible outcomes. If you have symptoms or risk factors for bladder issues, talking with your healthcare provider about whether a biopsy is appropriate for you is essential. Remember, early and precise diagnosis can make a significant difference in managing bladder health effectively.